The paradigm of medicine is really being shifted. We've always thought we were biochemical beings with hormones and communication like that throughout the blood, like chemical messengers. And we are, but it's starting to be clear that we are energetic beings, meaning we also communicate via frequency. And that to me is one of the most fascinating things I've discovered in my career. It is still being understood. It's still being unwound. And when you look back, it turns out that our ancestors knew a lot more about this. They knew that we were an electrical system long before they realized we were a chemical one. Because there are mummies dating back thousands of years that have acupuncture markings lined up in the correct spot. So that means they understood the flow of energy through meridians, which are like electrical highways, that those pathways existed, that when they were stimulated or manipulated, that they could have positive results on the health of people. That's really exciting, you guys. So that the fact that it's coming back around is super fascinating to me, because I think we've been hijacked to a certain degree by our obsession with medication and compounds and chemicals. And while they are super helpful, because I'm not against anything, I'm just more of a bridge here, trying to help us understand where one piece may fit, where another piece may fit, thinking that that's the only answer and not paying attention to the electrical side of our body, we're really missing the boat. And I figured this out in my career over time, because I would watch as patients would come in, we'd work on them with supplements, we'd work on them with hormones, we'd work on them. Sometimes they needed meds, we'd work on them with electrolytes and maybe vitamin drips, and they would get better. But there's a high percentage of people that we would get stuck with. Like they would hit a certain point and we'd be stuck. And I kept asking questions, and then eventually got exposed to some really creative entrepreneurs that built this machine. This was probably 15 years ago, that was color, music, and vibration. And this machine, they were testing it themselves, was, they said, reversing or supporting type 1 diabetes and other autoimmune issues. And they called the university local in town and said, we're having some remarkable success with this device and we'd like to get it studied. So they had very pure intent, like, let's get the science behind it. It seems to be helping a lot of people. And the university said, that's really interesting, and it's too out there for us, but why don't you call Dr. Koche? So Dr. Lisa. So they called me. This is way back. And that was my first foray into energy medicine. So I started opening some books, which were way over my head. And to be honest, there's still a lot of unknowns in this space, many. But what we do know is a few things, which is cells actually emit electromagnetic fields. So we can measure the strongest one coming from our heart, but we can measure electrical fields coming off of our body, which is pretty wild. So that's how we use EKGs, EEGs. These are monitor for your brain, monitor for your heart. So those have already been in medicine. They're using electricity, and we've just left it there. So now that we are going deeper, understanding there's more there, we're finding things like Albert Prop found, which is that there are photoreceptors for light. So literal receptors for light, which is another energetic frequency on our cells. So what else are we missing? We're learning now more and understanding more about cell membranes and how there is voltage potential, which is electrical, that needs to be healthy for us to maintain a charge, for us to maintain our energy. We know that we can get an idea about this through things like heart rate variability, through things like measurement of our mitochondrial function. Because truthfully, we need to maintain ATP, we use electricity there as well. Light, sound, electromagnetic therapies, all of them influence our cellular behavior in ways we are still understanding. And when we know some of the points that have been studied that have helped to fuel this is that we know red light helps ATP production and more. We know PEMF, or pulsed electromagnetic fields, enhance circulation. They can increase healing up to 3 or 4 times faster with fractures. Sound and vibration has been proven to influence our vagal tone. So we can get ourselves into a more parasympathetic state using these electrical / frequency therapies. And it makes me think back, I went through a lot when I was a kid with a teenager with my diagnosis of childhood leukemia. And I was also a musician. So I played the oboe and I had to practice, or I enjoyed practicing every day for like an hour. And it makes me wonder, was that a big part of my healing journey that I didn't even realize? So music is incredibly healing, you guys. If you're going through anything, getting like healing frequencies, which you can look up, there's a lot of studies on the different specific frequencies and what they heal. Get that set up and see if it doesn't make you feel better. We know grounding, getting your feet on the earth can help balance these electrical charges. That's free and easy. We get ions from the beach, from healthy air, the sun, another massive source of electrical supportive energy that's also free, especially you want to be outside first thing in the morning with sun exposure to your eyes and your skin without glasses or sunscreen, ideally, or even just 5 to 10 minutes, but as long as you possibly can. They kind of say the sicker you are, the longer you need exposure. And so make sure that you're doing some things right now, even though we don't fully understand like how this can help us in the big picture way, we're starting to understand how to bridge energy and chemical medicine. And there's exciting research going on, whether it's frequencies that could be sent to your home to help you heal, whether it's using sound yourself, like humming or using breath work to help with your vagal tone, which helps so many things heal in your body, whether it's the music frequencies I was just mentioning, whether it's PEMF, if you're trying to heal something, you can get PEMF therapies and red light therapies relatively easy for lower levels over the counter. Some of the higher, more powerful, you're better off getting at a performance-based clinic like we have here at ours at Spectra. But you can start right away. There's just make sure it's a reputable red light therapy device, and many of them have research with them. You want to look for that. And they've come down in price, which is really nice, and see lots of improvement from inflammation to pain to skin health to wrinkle reduction. So many great things, to nerve regrowth or decreased neuropathies when you use some of this light therapy. You can do slow nasal breathing, which helps. We don't have the science to show you exactly what it's doing, but we know it's helping coherence, which is something we look at with our heart and our brain. And when they're in sync, which is an electrical frequency type program or pathway, that you are healthier. So remember what I can say in summary, which is you are not just a chemical being chasing hacks without knowing what they're doing. Taking medication only or supplements only or without paying attention to your energetic and light environment, you're missing a big piece of the puzzle. So pay attention, embrace it, understand that thoughts are energy, check into where your thoughts are, give good energy to your body. Even just that alone, reconnecting to your vessel and doing it intentionally can help you heal faster. Let me know any questions you guys have. Make sure you subscribe. We'll have more conversations like this.